So decolonization literally means the repatriation of land and life, which is the return of land and life. And another way that the phrase, that the term is used is to decenter Eurocentric ways of thinking, being, doing, and connecting, and recentering indigenous and African ways of doing things. And so when we're talking about what it means to decolonize mental health, obviously, or maybe it's not so obvious when we're talking about decolonization itself, we first begin with the land because of the historical implications of colonization and imperialism. The experience and our understanding of mental health care has been formed from this history of pillaging, of harming, of killing, and killing off not just people, but ways of knowing and thinking. So when we're thinking about decolonization in mental health care, one of the easiest ways to begin is to say, what does it mean for us to consider the history of our mental health care system, recognizing that we live in a colonized society and reality? What does it mean to recenter indigenous ways of knowing and being around wellness, around connection, around what healing looks like? And then how can we support those populations that have been made marginal, beginning first with the original peoples of a given land where you live, and also extending to folks like my ancestry, where I'm not on my original land, but was forcibly brought here. What does it mean to create a space for those that we're serving to be able to reclaim their original ways of being and knowing?